So uncertainty and fear and worries can be common when you're faced with cancer. And and sometimes people think that they're not really sure, that healthcare professionals are there for them, that there is support available for them, and there is support available. So we encourage patients to talk to their doctors, talk to their nurses, and explain, let them know how they're feeling, if they are having worries and fears, so that we can talk to them about the services available and also normalize their concerns because it is very common. Patients who have stage 3 and stage 4 cancers are the patients that we're working with, patients with breast cancer and GYN cancer currently. And many times they are treated with immune therapies or targeted therapies. And there's some uncertainty about how long these therapies will last and work for them. So there is a lot of uncertainty, and fear of cancer progression is very common. It's one of the most common concerns of cancer survivors and cancer thrivers. So we want to make sure that they're aware that there are services available, and also to teach healthcare professionals, nurses, doctors, social workers, about some of the skills that we teach to help patients manage their concerns. Yes, so we adapted this program from a program called Conquer Fear, which was developed by researchers in Australia. And they have had success with their patients in a big, large randomized study. And it helped to reduce fear and uncertainty and worries in that population. So we adapted it to also focus on a little bit more on mindfulness skills and to adapt this intervention to patients that have advanced cancer. So there's really two parts. There's a mindfulness focus, um, teaching patients mindfulness skills and also mindset skills, some ways that they can uh, think about their thinking and kind of recognize some patterns that we get into in the train of everyday thinking, that we can help patients to shift, to find more of a middle ground with the worry. The second component is a focus on patients' most important values and goals. Oftentimes when folks are diagnosed with cancer or any serious illness, it's sort of like it's a big shock. And patients often find themselves doing things just to kind of get through it, but they may have sort of lost touch with what's most important to them. So we help patients to really think about, what are your core values? What would you like to focus on in the next, 4 to 6 weeks? To bring your actions and your goals closer to those core values. Because when you're living your life focusing on what's most meaningful, it gives you meaning and purpose. And it's also a source of hope. What our intervention focuses on is beliefs about worry and our thoughts and the ways that we're thinking, because sometimes patients think that worry can be helpful. And they think that if they report their symptom right away, or they're on top of it, calling their doctor's office frequently, that this will, help them catch a progression early. In some ways that works in the short term, but in the long run, it doesn't work so well. It actually increases worry. Some people also believe that all this worry is going to make my cancer come back. All this stress is going to increase it. So we teach that that's not really true, but a lot of stress can impact your sleep and other symptoms. So we really want to help patients get a handle on that. And so the benefits are that patients have reported increased self-efficacy and feeling like they're more in control, that they're able to choose where they focus their attention, even in the midst of a lot of distractions and other things that are coming at them, and that they have more flexibility with their thoughts and their feelings. It's not all or nothing, right? And I think they also have reported that the thoughts don't define them, that they create some distance between their thoughts and know that their thoughts and their fears are not always real. They may not be true. So we teach tools to bring on the relaxation response, to help patients feel more calm and centered. The mind and the body are closely related, and our emotions, our thoughts, our feelings affect our physical symptoms, because they can also interfere with sleep. They can also affect, you get that neck tension when you feel stress and worry. They affect our physical bodies, but they also affect, our emotions and our feelings. So they're all interrelated. And by helping patients to look at their thoughts a little differently and their feelings, to recognize their feelings and their thoughts, this helps to recognize first that they are all interrelated. And if you can help patients to shift their thoughts or shift their the way that they manage worry, the way that they think about worry, then that actually can influence their physical symptoms as well as their ability to handle the stress and to be more present and mindful. So triggers are something that is oftentimes unexpected. So it could be, you're going to a restaurant and you see the nurse that was taking care of you in chemotherapy, and that just sets it off, where you just all of a sudden get anxious and worried because that brings it all back. So we want to have these skills, teach these skills so that patients can use them to manage triggers. It is also, patients have told us that it helps them to focus their attention and their concentration, because many times they feel very overwhelmed. And people oftentimes think they don't have control over their thoughts or they don't have control over their worries. But the skills we teach helps them to know that they can focus their attention on what's most important in the moment. For example, if they get a new symptom, that's oftentimes a trigger, because many times we get a new symptom, an ache or pain, it was because we were playing pickleball or we were, just out with the kids. But patients kind of take to heart any new symptom. So in that case, oftentimes that there's a lot of worry around that. So we help patients to really think, okay, well, right now in this moment, what's most important? And can I, set that aside, maybe think about that later? One of the skills we teach is called worry postponement, where we ask patients to tuck that away, maybe write it down and know that, and come back to it at a later time in the day when they have really time to think about it and process it. And then that gives them, a little bit of relief that they can actually do their work, focus on that work, or if they're with their family or grandchildren, they can, be with them in that moment. So it's very important because patients oftentimes in our studies and are in active treatment. 40% of our patients on our last study were receiving chemotherapy, or they may be receiving immune therapy. So many times they're overwhelmed and they might not be feeling so well. So we really wanted to make sure that our program, our intervention is very tailored to that, so that we're teaching very accessible mindfulness skills, something that they can do quickly and easily. A lot of times people think about mindfulness skills as, oh, you have to sit down for 20 minutes and meditate or do yoga for an hour. And the skills that we teach are portable and they're meant to be pulled up in the moment. So fear of cancer progression is cyclical. And, patients that are going up for their scans or their doctor's checkup, their appointment, that's when the fear tends to really increase. And so patients, sometimes they'll say to us, well, I don't think I really need it. I just might have my scans, they're all clear, I'm good. But once they get to that point where their scans are due again, or something might come up and they might need to change treatments, have a little bit of a progression, then at that point, we want them to have skills, tools in their toolbox that they can pull out and use quickly. So we teach these skills not just to be used during a really stressful situation, but we want to teach them the skills early so that they can pull them out and use them when they need them. When you're out there on the front lines, doctors, nurses, social workers, chaplains, the important thing is to ask your patients how they're doing, how they feeling, are they having uncertainty and worries, and to normalize that concern, let them know that they're not alone, that there are resources available to them, there's supportive care services, there's depending on what their concerns are, we can refer them to different specialties in supportive care. And then also to talk to your patients about it, because patients are afraid to bring that up. They're oftentimes thinking you're responsible for helping them with physical symptoms and getting them through. But when you bring up as a provider, when we bring up that the patients that this is a common concern. It gives a patient permission to talk about it. The other thing is to teach that you can teach patients some brief mindfulness skills. There's videos out there on YouTube that you can direct patients to help bring those concepts across, and they're not long. They're 10 minutes or less. And then also to practice mindfulness yourself, because when you're mindful and you're able to really be present with the patient, then you're more able to help them, because the therapeutic relationship is in and of itself helps patients to heal.